Hello everyone. Today we will study about diabetic foot gangrene. Diabetic foot gangrene is one of the most dangerous complications of diabetes if left untreated and can result into amputations or even death. Amputation means removal of the limb. So, before studying about diabetic foot gangrene, I want to tell you about diabetes mellitus. So, diabetes mellitus is a metabolic disorder. It is a genetic autoimmune metabolic disorder involving inappropriately elevated blood glucose level. The normal value of blood glucose level in a patient, in a normal person, is below 99 milligram per deciliter. If the patient is in fasting state, fasting means if the patient has not eaten any food before or since 8 hours. And postprandial means after meal. After taking meal, the blood glucose level elevates up to 140 milligram per deciliter. So these are the normal value of blood glucose level. And if the serum blood glucose level up increases up to 250 milligram per deciliter or more than 250 milligram per deciliter, then that patient will produce symptoms like polyuria and polydipsia. Polyuria means the frequency of urging to urinate increases, and polydipsia means increased thirst. So now the signs and symptoms of diabetes mellitus. There are 3 P's in diabetes mellitus. These are the 3 P's: polyuria, polyphagia and polydipsia. Polyuria means increased frequency of urging to urinate, and polyphagia means increased hunger, and polydipsia means increased thirst. So these are the 3 P's of diabetes mellitus, and there will be weight loss, fatigue and body ache. And I'm not going to explain diabetes mellitus in detail in this video. I'll make another video for diabetes mellitus. So in this video I am going to explain only about diabetic foot gangrene. So now let's talk about diabetic foot gangrene. Gangrene is a condition which develops after necrosis. Necrosis means death of any tissue and gangrene means putrefaction. So this is the pathology of diabetic foot gangrene. So what happens is, in chronic hyperglycemia means a patient who has developed increased blood glucose level since a long duration is known as chronic hyperglycemia. It causes destruction of lipids and proteins, and this process is known as glycation. And this glycation, it leads to damage of small blood vessels in the organs like retina, a part of an eye. It leads to diabetic retinopathy, causing blindness. And kidney, damage of small blood vessels in kidney. It leads to diabetic nephropathy. It leads to dialysis. The patient will go for dialysis. And next is peripheral areas. This damage of small blood vessels in peripheral areas, it leads to diabetic foot. And this pathology I will explain you later. And diabetic neuropathy means damage of small blood vessels in the brain. So due to the process of glycation, the small arteries that supply blood to the nerves gets damaged and leading to peripheral neuropathy, as the nerves are also getting damaged because they are not getting enough food, because the small arteries, they are getting damaged. So there will be no sensation in the peripheral areas. And in this condition, we should go for monofilament test in diabetic patients to examine the nerve damage of the foot. Any injury on the foot or severe burn would lead to diabetic gangrene due to no or reduced blood supply to the nerves, as the arteries are getting damaged due to the process of glycation. So the nerves will not get enough food. So the nerves are also getting damaged. So any injury on the foot or severe burn would lead to diabetic gangrene. So now the diabetic gangrene. Diabetic gangrene is a wet kind of gangrene. Gangrene are of three types. Mainly they are of three types. One is wet gangrene. Wet gangrene develops when there is a combination of bacterial infection and injury. Then it leads to wet gangrene. And the second type is dry gangrene. Dry gangrene develops if the blood supply to a particular part of our body gets blocked. Then it leads to dry gangrene. And the third one is gas gangrene. Gas gangrene develops inside the body due to any bacterial infection inside the body, and the bacteria it release gas leading to gas gangrene. So now the signs and symptoms of diabetic foot gangrene. So as you can see in these two pictures, the gangrenous areas of the feet. So the first symptom is numbness, tingling, and burning sensation due to damage of the nerves. These 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 three symptoms: numbness, tingling, and burning sensation. These three symptoms are showing that there is uh, some damage to the nerves. And as we have studied earlier, due to the process of glycation, there is destruction or damage of the small arteries that supply blood to the nerves. So the nerves are also getting damaged because the arteries are getting damaged. So there is symptoms like numbness, tingling, and burning sensation. And now there will be changes in the color of the skin. As you can see in these two pictures, the color of the skin is changing from the normal skin color to purplish black, purple or black color on the feet. And you can see the cracks on the feet, and these changes of color and the cracks, it it is showing that there is poor blood supply to that particular area of the feet, of the body. And the non-healing ulcer or repeated injuries on the feet and the foul smelling on the feet indicate poor blood circulation or, or nerve damage. This non-healing ulcer and the foul smelling from that affected area, it indicate that there is poor blood circulation and nerve damage in that particular area. Now the diagnostic criteria of diabetic foot gangrene. Uh, At the first, we go for tissue culture. In tissue culture, we tissue culture is done to determine the bacteria which is being responsible for the condition, that is diabetic foot gangrene. And after tissue culture, we go for arteriogram. In arteriogram, we inject a dye inside the artery, and after injecting that dye, we check the artery with an X-ray to look for the blocked arteries. And the third one is CT scan and MRI. In CT scan and MRI, these two imaging techniques are done to determine the uh, spread of the gangrene. If the gangrene has spread to the inner tissues like bones. And surgery. The fourth one is surgery. Surgery is done if the gangrene has spread to bones, then we go for surgery, that is amputation.
So now the homeopathic management of diabetic foot gangrene. The first is Vipera berus. We prescribe this remedy if there is bursting ulcers, which are dark, red, and dry, and they are insensible to touch with foul smelling. If these kind of symptoms are seen, then we can prescribe Vipera berus. Vipera is a snake remedy. The second one is Bothrops lanceolatus. If the gangrene is of right sided, then we can prescribe this remedy, Bothrops. And the third one is Tarantula cubensis. Bothrops is also a snake remedy. Tarantula cubensis, the third one. Tarantula is spider remedy. If the color of the skin changes to purple and with a burning and stinging pain, then we can prescribe Tarantula. And the fourth one is Sacrum officinalis. Sacrum officinalis is prescribed the ulcers of the lower limb and repeated ulcers. Or non-healing ulcers. Repeated or non-healing ulcers, if seen in any part of the lower limb, then we can prescribe Sacrum officinalis. And the fifth one is Sickle cornetum. Sickle corn is prescribed if the gangrene is dark or black in color with foul smelling, with foul offensive discharge is coming out from the wound, and there would be numbness, mortification of the gangrene.
And the next remedy for diabetic gangrene is chlorum. Chlorum can be given in cases of gangrene externally as well as internally. External means by the help of ointment, and internal application means in the form of globule or dilution. And the next most important remedy for diabetic foot gangrene is arsenic album. It is given in cases of septic infections, non-healing septic infections in the lower limb, and in gangrenous inflammations. So these are the homeopathic remedies for diabetic foot gangrene. So, this is all about diabetic foot gangrene.